Welcome to Public Health Matters, where we talk about what matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And I'm joined today by Lisa Vasquez, Behavioral Health Strategist with the Division of Public Health. And thank you so much for joining me today, Lisa.
It's a pleasure.
We're going to start with a health update, as we usually do. So we'd just like to let everyone out there know about what's going on with COVID. We have two maps, one from just yesterday and one from a few weeks ago. And you can see from the map that, it's pretty green in a lot of places. I would point out that you will notice that New England has a little bit more yellow and orange activity than we'd really like to see. And just as a reminder, the yellow on those maps is medium transmission. So we are seeing more hospitalizations in the area for COVID-19 and more people being treated for COVID-19. So just, again, use those precautions that we take. If you're going to be indoors with people that you don't know in a crowded place, it's a smart idea right now to throw on a mask. We can look at New Hampshire a little bit more closely, and you'll see that on October 6th, we had that strip running through the state. And now we have the same strip, but we've added a county. And the outline is Nashua, of course. So we are at medium transmission, and we have not changed from 2 weeks ago. So again, take those precautions, especially if you're immunocompromised, if you're over 65, if you're going to be indoors in crowded places. A reminder that the bivalent booster is available, and that can be found in most pharmacies. And that protects you against Omicron and the original strain of the COVID-19 virus. And I will say I heard that on a webinar today. They were talking about how, this new bivalent booster is 50% of the original strain and then 50% of the Omicron variant. So it's not just protecting against the variant. So really important if people can get their shots. It is recommended 3 months after infection or 3 months after your last booster. So some of you may have had a fourth booster or a fourth shot or a second booster, as they say. All these numbers get a little bit confusing, but just make sure that you check your records and see if you are due for another booster. We're going to move on to monkeypox. It's quieted down, so nationwide we've seen that it is trending down. Trending down in New Hampshire. We've really held steady with 30 cases in New Hampshire, and that has not changed in about 2 weeks. I do sit in on some of those calls, and we hear about that. Overall, in the United States, we have 27,635 cases. I want to remind people that it's spread through close or intimate contact, prolonged face-to-face contact, and touching infected fabrics, bedding, towels, and clothing, and then putting that near your mouth or any of those things. So just want to remind people that you do have to have that close contact, and it is prolonged. It is not like COVID. It is, that really hours and hours of contact. Just to let people know, to qualify for a vaccine, you do not have to have been exposed to the virus, but you do have to have some of the risk factors. So persons who identify as gay, bisexual, queer, or another man who has sex with men, they are at risk for monkeypox virus infection. And that includes persons in a monogamous relationships who have a sex partner who may be at higher risk for monkeypox. So persons also who report exposure in the last 14 days to another person infected with the monkeypox virus or contaminated objects. And then if you are exposed, it is recommended that you get that vaccine within 4 days of exposure. But hopefully people are taking their precautions now, and if they are in any of these risk categories, to go and seek out that pre-exposure vaccination. It's a 2-round course, 4 weeks apart. Sounds very familiar. We're getting the hang of it, I think, with these immunizations, but I really do highly recommend that people pay attention out there. And if you have any questions, you can email directly to the state at monkeypox@dhhs.nh.gov. And we have a map here with all the vaccination sites. It is really statewide. The state's done a great job of getting it out and available. Most of the convenient MDs. We do have it in the Nashua and Manchester Health Department. So please, if you are at risk, please give us a call. Before we started those cameras, we talked a little bit about RSV, and I have a slide here about crushing that flu bug. So we're in flu season. We're already seeing flu in the hospitals. We're seeing flu in provider offices, mostly influenza A from what I'm understanding right now. So we're just asking people to please, please, please get that flu shot. You know, it's not a Band-Aid, it's not a miracle cure, but it is preventive in nature. And if it can reduce, you know, the severity of your flu, that's a great thing. So we just ask that you get that shot. And we're seeing a lot more flu because we've all been in masks for the last 2 years. And now that flu, its job, as was just explained to me, is to recreate itself and to stay alive. So it is really looking for hosts for the flu. And similarly, we were going to talk a little bit about RSV.
Because there are multiple respiratory viruses. So
Right.
there's RSV, there's enterovirus, there's the common cold. There's so many viruses out there, but the good thing is that we know what to do because we've been told over and over again due to COVID the things to do to prevent illness. So things like washing our hands frequently, wearing a mask when we're out around, you know, large crowds, making sure that if anyone is sick that they stay home, especially little ones. If they have RSV, it's very contagious, and if they're in daycare, it can make little ones very sick. So making sure that if any child is sick, that they stay home, that you contact your pediatrician, your primary care provider, make sure they get tested for the COVID, for COVID, for the flu and for RSV will
Right.
be very important, because that way you know what, you know, the treatments will be for that child.
Right, and that's, you know, it's critical. And like you said, infants are much more prone to severe RSV and to hospitalization with it, especially those that are in daycare, like you said. So we just really want to encourage folks that, and I can't emphasize enough, Lisa, the whole stay at home if you are sick, or keep your kids at home if they are sick. We understand that people need to work, and this can be very difficult. But there's no more, you can't do it. You can't send them with some Motrin and hope that like their fever passed. They really need to be at home.
And some of those viruses can be very severe, where even if you have both, you know, Tylenol and ibuprofen, sometimes that fever still, it needs to be kept an eye on. You need to talk to your provider if you aren't able to control that fever. So it's really important, not just because you have to work, but you really need to keep an eye on your child. Are they breathing? Are they having difficulty breathing? Because they are respiratory viruses, and RSV can cause bronchiolitis that can lead to pneumonia. So we want to make sure that those kiddos, someone's keeping an eye on them.
Absolutely. And there was another sign that that shallow breathing, the wheezing, and also like a bluish tint to the fingernails, especially among the infants. That is indicative of not getting enough oxygen. So let's just keep those things in mind as we get through, because it's getting colder and we're going to be inside more, and we just want to make sure people are protected. So it's also October, getting toward the end of October, but it is Breast Cancer Awareness Month, and we were really fortunate to have Dr. Gautami Rao join us a couple weeks ago on Public Health Matters to talk about breast cancer prevention. But we do want to remind folks to wear your pink. We're wearing our pink. Well, Lisa's sort of wearing her pink. I'm wearing my pink. We're all wearing it at the office today in honor of Breast Cancer Awareness Month. And just a reminder for people, women age 45 to 54 should get mammograms every year. Women 55 and older should switch to mammograms every 2 years. I mean, age does have its benefits. At least I'm telling myself that. And or you can continue yearly screening if you're at high risk. If you have a genetic background, you should of course keep that annual screening. And then screening should continue as long as a woman is in good health and is expected to live 10 more years or longer if we only had a crystal ball. But I guess we're just saying, you know, continue as long as you're alive, but you can go to those every 2 years after 55.
One thing I learned recently is that once you turn 40, you should have a mammogram to have like something to compare the
Yes,
other
the
ones
baseline.
to. So the baseline, yeah. So you don't have to wait till you're 45 to start. You would start at 40, and then at 45 have the continuous ones.
Right, that's a good reminder. So that's true. You want to have that baseline because they just compare. They're looking for changes. And similarly, women should be looking for changes as well. Just be aware, self-aware if you notice a change or something sticking out in your body that shouldn't be. Do those monthly,
Wasn't there.
any discharge, but you want to just do any kind of self-breast exam that you can do. Easy peasy in the shower. I won't get into too much details. And also there's the whole idea of family history. So if you do have that family history of breast cancer and other cancers, you just want to pay, again, a little bit more attention when it comes to this. Very curable, as I learned.
Yes, and when you drive by Southern, you see their big sign that says early detection is the best prevention. So we want to make sure that people are able to, get that early detection done, not be, scared or have, be shy about it. It's our health and we need to take care of our bodies.
Yeah, and it's really come a long way. I can say, like, from the early days, it's still not like the most pleasant thing, but it's come a long way with the imagery, and they're being able to really see things way ahead of time. And if you catch that early enough, as Dr. Rao explained, this is very curable, very preventable. I don't want to say very preventable, but very curable. And there's a very high rate of cure. And then just to remind people to keep doing those healthy eating, avoiding the sun, and getting that exercise. And those are all things that will help prevent any type of cancer, and including breast cancer. So I didn't bring you here, though, to talk about us wearing pink and you sort of wearing pink. So Lisa works as a behavioral health strategist and works a lot with mental health and substance misuse and prevention. And in public health, we're all about prevention. So I'm going to start with the first thing that's on the agenda, which is the DEA Take Back Week. The Drug Enforcement Agency?
Yes, the DEA, the Drug Enforcement Agency, has their National DEA Take Back Day. It happens twice a year, once in April and once in October. October 29th is our next one. It's from 10 a.m. to 2 p.m. 12 out of our 13 towns are participating. So
amazing.
It's the highest number we've been able to have, so it's really exciting. I get the opportunity to drive around in October, which is my favorite, and see all the beautiful
drive
foliage.
around.
Yeah, and visit all the PDs and make sure everyone's ready, has all their materials that they need, know what to do, know their location. We help them promote the event. Yeah, so it's a lot of fun, but and we're also highlighting this year on our social media all the police departments that are participating. We started yesterday with Pelham PD.
Right.
So it was great to stop by and say hi to all the officers, see what they're seeing, if they have any needs from public health, any support that they need, any training needs. So it's a great opportunity to go around, but it's also a great event. So if people have any unused, unwanted, expired medication that's at home, we want to make sure no one flushes it down the toilet. Please do never flush your medication down the toilet.
I was going to ask you that because that is like really important, especially in like places where I live, which is a little bit outside of Nashua. But, and even in Nashua, I'm sure if you're on well water, you do not want to be flushing that down and re-ingesting it in some other form.
Exactly. So it goes into, the water system. It goes into our drinking water. Animals drink it. It goes into our environment. So we want to make sure no one does that. And the Take Back Day is a great event to be able to dispose of those in a safe way. So 12 out of our 13 towns are having Take Back Days. Most of them are at the police department. Hollis is having it at the Hollis Pharmacy. Hudson is having it at the Hudson Walmart. And the Nashua Police Department has it at the DPW, which is really across the street, really, from the police department. They make it a drive-through so that people don't even have to get out of their car. It's really convenient.
Yeah, and this is like no judgment, no questions asked. And, I think this originally started, when you think about it, is, we were finding that people were keeping maybe a couple extra pills around. that they didn't need from, say, a dental procedure or whatever, and we just don't want those pills to get into the wrong hands in a household as well. And so it's just so important. And then it's really for any medication. And I'm so glad you mentioned my town so that I remember, because I have all these little bottles and, you know, I'd like to dispose of them safely. And I don't want to, like you said, I don't want to flush them down the toilet.
So it doesn't matter what medication you have, you can, you know, dispose of it in this way, making sure that it's not a liquid and there's no sharps. But it doesn't matter if it's a patch or if it's a pill. It doesn't matter if it's like for high blood pressure or if it's an opioid. All of them can be disposed safely. We don't always think about like non-opioids very much when we think about, you know, keeping our community safe. But if a child takes a medication, it doesn't matter what it is, it can be very harmful for that child and even an adult, because if there's a medication that's prescribed to me, it is for me. Usually they make sure it's, you know, the amount of milligrams for your weight. The doctor knows all your underlying conditions, all the things that might affect that medication.
Sure.
So if I gave that medication to you, you might not react in the same way that I would, because you might have other things going on in your body. So it's really important for us not to share medication. And a lot of people think, well, I'm just being nice. I'm just giving, you know, you a medication that helped me, but it's not a good idea to share.
Don't be neighborly.
That's a no-no. Don't share your medication.
Yeah, I'm always amazed by that. I'm like, oh, just share that. I'm like, no. You
never know how someone else might react. They might take another medication that counteracts that. So it's really important for people not to share their medication. Again, if you have a lot of medication at home that are expired, unused, unwanted, you don't know who comes into your home who might have a substance use disorder and might decide to take those. So it's better to not have them and avoid that risk.
I 100% agree, and I am going to go in a week and a half. But it's really important. So again, that's October 29th?
29th from 10 a.m. to 2 p.m. But the lucky thing that we have in this area is that most of our police departments have you know, permanent take-back boxes. So we really hope that people go out on October 29th. It's a great opportunity to promote the fact that we have permanent take-back boxes, that people are able to clean out their medicine cabinets and get rid of things that they no longer need. But they can do that anytime at most of our police stations. There's also take-back boxes at both of the hospitals here in Nashua, and also some of our pharmacies have take-back boxes too. So you can also ask your pharmacist if they're a location where you can dispose of unwanted, unused medication.
Yeah, so even if you miss the day, there's still lots of options, and I need to tell myself that too, because I'm, you know, sitting on all these bottles of old prescriptions that I just didn't need to finish, or, you know, whatever. So
and many people think
I'm going to do it this year.
Many people think, well, what if I need it later, right? If
then
they
it
have
expires.
It expired, one, and two, if you have another issue later on, it might be different too. So that medication might not be
as effective
anyway.
Right. So drug DEA Take Back Day, get those pills out of your house. It makes your medicine cabinet look so much nicer too. Just as on a aside, those they tend to be small, so let's get them all tidied up. Little fall cleaning. And then we have Red Ribbon Week. Oh, didn't I do that well?
Yes, you did.
We will not say that 3 times fast. That's coming up. What date does that start?
So it starts on Sunday, October 23rd, and it goes for the full week. Red Ribbon Week started in the 80s, and it had a really sad start. So there was a DEA agent who was killed during their job trying to keep our countries from getting drugs over the border. They were killed by a cartel, and in his honor, we celebrate Red Ribbon Week.
Very good.
I know, I have to say it slow, so that people raise awareness of the fact that we can live, you know, our lives drug-free. So this year's theme is Celebrate Life, Live Drug-Free. So you'll probably see your kids come home from school with materials this week that have to do with Red Ribbon. It might say, you know, Celebrate Life, Live Drug-Free, and things like that. But it's all about mental health wellness, because we know that if we have mental health wellness, if we feel like we're seen, heard, feel connected to our community, those kids are less likely to use substances to self-medicate. So
It's
that's
important. So you have a lot of
yes.
things going on in the high school. I noticed that the Nashua Prevention Coalition is putting some materials out into the high schools, and they're giving them some resources. Middle school also, I would assume.
So elementary school, middle schools, and high schools all participate not just in Nashua, throughout. It's a national campaign, so kids all over the country are celebrating Red Ribbon Week. But here in Nashua, we know that like the youth council is working with the high schoolers, with the Students Against Destructive Decisions groups.
The SAD groups.
Yeah, I just rather not say SAD groups. It sounds funny.
I know. It sounds sad, but it is what it is.
Yeah, so those groups are doing activities all throughout the week. And then in middle schools, they're starting some Students Against Destructive Decisions groups because they have, after COVID, they weren't really meeting. So they're rehashing them.
Yeah.
And then
Bringing them back.
Yeah, they're bringing them back. And in elementary school, usually they have like the door decorating contest. They'll have some coloring, and they'll have a lot of things that remind kids to take care of their mental health and well-being.
Which is so important. Kids are back to hopefully into a more normal routine. And it's just so important that we kind of come back to where we were prior to the pandemic beginning, and, you know, making sure that we recognize to take that minute about, like, I love that, celebrate life and live drug-free. And, you know, this has been going on a long time because I did a little research too, and this started during the Reagan administration with Nancy Reagan, and Just Say No. And I just remember that as a kid.
And sometimes I'm like, oh, it started the other day in the 80s, and then I have to remember that the 80s was a while ago.
Yeah, I know. Well, tell me about it. Yeah, I finished high school in the 80s, so, you know, they were great years, though. And then the last thing I wanted to talk to you about around behavioral health, mental health, is the new suicide crisis line. It's, again, a nationwide initiative, National Suicide Prevention Lifeline, 988, very important, very easy to remember, hopefully, for people. And in case people don't realize it, this is why we're all dialing 603 before everyone's numbers now, because in order for the system to function properly in our area code, we did need to make that adjustment. So we've all been affected by that, but I hope that people will know that this is a resource to call.
It's a great service. People call, they get connected to a mental health provider. They're able to answer questions, provide resources, and even try to de-escalate situations if it's in a moment of crisis that people are calling. But if they are not able to de-escalate the situation or get the person to a safe space, they can connect them to like regional mobile crisis teams and have them deployed to that person. So we really want people to know that they're not alone. Services are available, and that their mental health matters, and when we care. It's really important. I feel like we don't talk about our feelings enough, and we were talking about that earlier today in the radio, but it's really important for us to be able to talk about our feelings, whether they're negative or positive. And I know that sometimes when they're negative, we're like, oh, I don't really want to hear that.
Right.
Let's focus on the positive. And sometimes that we have that toxic positivity where we try to like,
Oh, I like that.
yeah, where we try to like not see anything negative. And that's also not helpful, because feelings are feelings. And we need to sometimes feel those feelings to be able to process them and get over them.
And
So if
move
we,
along,
yeah, so if we just like push them down all the time, at one point or another, things are gonna pop and
Yeah, you rip at the seams a little bit. So we do want to remind people, 988, you know, it's a really good resource, and it's nationwide. So if you're traveling or wherever you may be, this is a resource for everybody and for family members across the country. Just really kind of glad to be able to, sorry that we need it, but glad to be able to promote it today. And that's all we have in the behavioral health front, although there's always so much more to talk about.
so much.
But we do want to remind people that we have our own clinic at Nashua Public Health, and that we offer childhood immunizations and some other adult immunizations on Tuesdays and Fridays, Tuesdays from 4 to 7 and Fridays from 9 to 12. We are really trying to reach out to the uninsured and underinsured. We also have a sexual wellness clinic on Thursdays. That's from 3 to 6 p.m. And on those immunization clinic days, we can also do lead testing. So if you have any suspicions that your child may need a lead test, please come on in. Call 603-589-4500, press option 2, and we can make you an appointment. And that's all we have for you folks. We hope you have a great, safe, healthy rest of the week. And remember, the public's health matters.